8 out of 10 adults experience back pain at some point at their lives, and it's very common for the episode of back pain to recur. I've had also back pains and I know how to live with them when they occur. And later you get great tips how to cope with the back pain when it occurs. Back pain is a bit like a cold, and certain factors are contributing to increase prevalence of back pain. In this video, I'll preview how back pain can be treated and what factors underlie back pain. The material for this video is based on the new guide from Selkäkanava, and link is down in the description. The back is incredibly resilient superstructure of the body, and it's something you should use and maintain. The back structure includes 7 cervical vertebrae, 12 thoracic vertebrae and 5 lumbar vertebrae. And there is also sacrum and the coccyx, meaning tailbone. Between the cervical, thoracic and lumbar vertebrae there are intervertebral discs, what are gel-like masses. Their purpose is to act as a shock absorber, enable spinal movement. The vertebrae of the spine are connected to each other through the facet joints, and the level of these joints varies when you go down from the cervical to lumbar spine. Facet joints stabilize spinal movement. Changes in the structures of the spine are inevitable as we age, much as like wrinkles. We can't determine someone's health solely based on the wrinkles. Similarly, for the example concerning about the lumbar spine MRIs, it reveals significant numbers of findings, which are entirely normal. If a client imaging findings align with their symptoms, then it becomes relevant. If you want more information about how common imaging findings are, check the link down in description. Low back symptoms, pain, muscle tension and stiffness are localized between the lower rib and the buttock creases. Often radiating symptoms may occur in the lower extremity, such as tingling, numbness or muscle weakness. This indicates irritation of the nerve root originating from the spine. In this case, it's good to investigate during physio consultation whether there is a way to reduce the irritation of the lower extremity nerve through some means. Lower back symptoms can be classified by duration. Acute, in other words, sudden pain, lasts from few days to 6 weeks. Prolonged pain is discussed when it lasts from 6 weeks to 12 weeks. If the symptoms has been present more than 12 weeks, then it's classified chronic. How can lower back symptoms be categorized into different groups also? The largest group, around 90% of the clinic patients, fall into category of non-specific, meaning unexplainable benign back symptoms. This pain can result from minor tissue damage in the back, such as muscle, intervertebral disc or ligament strain. If the symptoms occur suddenly with the strain, it's then often referred as lumbago. The next most significant category of low back symptoms is 5 to 10% radiating down the leg, known as sciatica.
I can't feel my legs.
In this case, the nerve root originating from the spine is irritated or compressed, and most of these cases improve on their own within few months.
I can't feel my legs.
In this situation, during the consultation, it's good to determine whether there is a specific structure or area that could potentially cause pressure to the nerve root. If so, then appropriate maintenance can help alleviate the leg radiating symptoms. Last category of the low back pain is a possible serious or precisely defined causes. These account for 1 to 2% of the patient population. In these cases, the client's symptoms wave multiple red flags, and it's a good idea to seek medical treatment. Typical red flag situations include unbearable pain that doesn't ease in any position, impaired ability to perform daily tasks, fever or deteriorating general health in connection with the back pain has come from the accident, you have had cancer, challenges controlling urination or defecation, weakness progressing in leg area. What factors can slow down healing? If client believes that pain and activity are harmful, then you must encourage them to get moving again. Excessive bed rest and general passivity only prolonging back pain recovery. Other factors can slow down healing may include overcaution and fear of the pain and injury which limit the movement, depression, anxiety and social withdrawal, work-related issues and job dissatisfaction, overprotective family or lack of support, pursuing various treatments, receiving negative, frightening or incorrect information about the back pain. What factors influence the back pain? When considering prolonged low back pain, predictive factors include, among others, genetics, severity and breadth of the symptoms, sleep disorders, multiple health issues including asthma, headaches, diabetes, mental health problems, overweight and smoking. If you want to have impact in the prevalence of back pain in the long run, then general health promoting habits, regular exercise, healthy diet and sufficient sleep are good foundational pillars for the treatment. Through the training and movement, you can also shorten the duration of the back pain episodes and reduce their recurrence. With regards of the younger generation, you should definitely be a good example in these aspects. If your job involves heavy physical strain, prolonged work in forward-leaning or twisted posture or tasks what involve lifting heavy loads, then these kind of strains can contribute to prolonged back pain. Unfortunately, as we age, our physiology deteriorates year by year, which why self-initiated training is extremely important. Excessive strength and endurance reserve will help you cope, while too little won't be as effective. If your back pain doesn't seem to alleviate on its own, or if episodes of back pain frequently recur, then you can seek direct access with physiotherapist. The idea behind direct access is to ease the pressure on the doctors and provide time to examine client symptoms, picture and determine appropriate treatment. This requires attitudinal training, which I have done also. During the consultation, it's assessed whether the medical consultation is needed, and in most of the cases, it isn't necessary. However, in such cases, the doctor's role is to rule out dangerous diseases and diagnose conditions that require more specific treatment. Traditionally, during the direct access, aspects related to client symptoms picture, illness and medication are investigated. I'm particularly interested in these factors that intensify and alleviate client symptom picture and how the client describes their symptoms. Different pain mechanisms typically have specific narratives, and through these we can understand how to alleviate the client experience symptom picture. Once the interview is completed, the clinical examination is conducted based on the symptom picture. If the client symptom picture includes radiating leg symptoms, then muscle strength testing of the lower extremities is conducted manually, and the sensation and reflexes of the lower extremity are observed in standing position and while lying on their back. The role of the pain medication in the back pain is to alleviate the symptoms, ensure adequate sleep, and aid in daily functioning and movement. Paracetamol is the most primary self-medication option, and it should not be used at doses exceeding 3000 mg per day. Two different NSAIDs should not be used simultaneously, and always follow the dosage instructions on the packaging. If you experience side effect or medication or something usual occurs, then always seek help from your treating doctor. Pain medication can be used to 2 to 3 days, or if necessary even 5 to 7 days. Use the short-term pain medication only for the brief periods and avoid taking medication unnecessarily. Additionally, it's important to note that medication must have clear or at least partial effect on the symptoms what you are experiencing. If this is not your case, it's important to inform the healthcare professionals from that. Furthermore, underlying health condition or other medication can affect suitability of the pain medication, and in those cases it's always necessary to discuss the benefits and risks of medication with your doctor. Best investment you can make yourself is getting enough of the sleep. It's crucial for the body's and brain's recovery. If the sleep problem starts to rise, the body may become more sensitive to pain. For this reason, it's good to strive regular sleeping and waking times. Before sleeping, prepare yourself calming state by avoiding bright lights and loud noises. Caffeine and alcohol may reduce sleep quality. Stress factors also expose you to pain, and prolonged pain, there is usually some degree of the stress involved. Try to identify factors that help you to reach the relaxed state. This can release the muscle tension and alleviate pain. If you want, you can try the breathing exercise found in here, which calms the body. Revisit and immerse yourself with the pleasant things and hobbies, both practically and in your imagination. Be your own best friend. Don't expect too much from yourself and treat yourself with the compassion. Through socializing, you can reduce feeling of the loneliness and stress. Unfortunately, due to pain, many tend to withdraw, and you've surely been in a situation when the presence of the wonderful people have lifted up your spirit. Moderately challenging exercise and healthy diet supports recovery and stress tolerance. So, what other things should you remember in your daily life and work? Strive to vary working posture frequently through the day and use the adjustment available at your workstation in a versatile way. You can find the playlist related to ergonomics in description below, which surely includes all the necessary adjustment instructions. Aim to take breaks from prolonged sitting regularly, do some stretching or the break exercises during the workday or when traveling. If your work involves challenging working posture or handling heavy loads, it's a good idea to discuss with your superior how factors contributing to the back pain could be temporarily reduced until the back symptoms calm down. In physically demanding work, your body can cope well if you are in good shape. Additionally, it's important to remember that most of the back pain lasts short time and the symptoms often alleviated even without doctor visit. However, back pain rarely signifies to serious injury on the background. Remember to go upwards. Gradually increase the number of things you do. As your back pain lessens, you find that your limitation is decreasing. Your body recovers from strain overnight, so cherish good sleep. Daily exercises strengthens your body's own pain-regulating systems, keeping functionally excellent and recurrence of the back pain minimal. However, the back is structurally robust and can withdraw various strains as long as it's gradually accustomed to them. If you found this helpful, hit the thumbs up and check the description down below. There is plenty more stuff. And see you at the next one.